Today we're going to talk about what is clearly my favorite soft tissue technique, and that is active release technique. So what's so special about active release techniques? Well, to answer that question, let's first go on a little bit of a journey into what makes a muscle a muscle. The most foundational component of muscles are sarcomeres. A sarcomere is a part of a muscle cell, and a sarcomere is an arrangement of two protein types, actin and myosin. And when the muscle cell releases calcium into the space between these protein fibers, the muscle contracts. So when the muscle is stretched, it looks something like this. These sarcomeres, there can be many thousands of sarcomeres per muscle cell, and the muscle cells are then organized and tied together, and then they're packaged in little groups, and then there's a bunch of groups in each muscle. These units of muscle cells are then packaged and create all the different muscle sizes and shapes in our whole body with all sorts of different, varied, and unique attachment points. So how does your body determine how much tension each muscle should have? Well, there's specialized cells that run in parallel with your basic muscle cells, and these are called muscle spindle cells or intrafusal muscle fibers. And these special cells are in direct communication with the spinal cord, and the spinal cord is in direct communication with them. This is fundamentally how the body keeps track of the state of the muscle and regulates the tension in the muscle. From a more in-depth neurology book, here's a look at what these muscle spindle cells look like. As an electrical engineer looking at this, they kind of look like little inductor capacitor circuitry that measures things like rate of change of the muscle, contractile length of the muscle, things like that. Going even deeper into this muscle dive, every muscle in your body has a different innervation number. And this is like a measurement of how finely controlled that muscle is. The lower the number, the more finely controlled it is. As you'll see from this chart here, something like your biceps muscle has an innervation number of 750, whereas the muscle that moves your eye laterally, the rectus lateralis, has an innervation number of 5, meaning it has very fine control, which makes sense for something like your eyeball. I know that's all super nerdy and kind of complicated, but when it all comes down to it, muscles respond to force. Their language is force. And if you want to speak their language, you got to know where they are, and you got to be able to apply force, and you got to do it in a skilled and careful fashion. And that's why ART is good. So here's a quick list I made of why I think active release techniques is pretty great. It requires thorough anatomical knowledge. Everyone's got to pass a test. And that test is essentially an anatomy test, as well as a patient motion test and a palpatory test. Incorporates patient movement. It's a great part of the technique because incorporating patient movement helps with relearning different movement patterns. It emphasizes that you can really develop good palpatory skills as an ART provider, which some people I know have insane palpatory skills. And then there are definitely superior levels of tension produced in the muscle when using active release techniques. And I think this is pretty unique to ART, although some other techniques I'm sure developed lots of tissue tension. But because the muscle cells speak in the language of force, force is how you get them to change. And then a bonus is a powerful but simple diagnostic algorithm, which I'm going to go over with you right now. The diagnostic algorithm is essentially as follows. Use palpation to find where the problem is. Differentiate and make sure you're on the right structure. You treat the structure using the protocol you learned in class, and then you repeat the original motion. And you basically run through this algorithm until the symptom is resolved. Very simple, very powerful. Every ART course has many pages of protocols, usually somewhere between 60 and 100 protocols that you need to learn. And then you are tested randomly on the protocols that you learned over the course of a weekend. This is one of 3 pages from my favorite course in ART, which is nerve, which is where you learn how to palpate where a nerve is and release it from tissue that it might be stuck to or being compressed by. I hope you found the video informative. Please hit me up in the comments, ask me any questions, give me some more ideas for future videos. Catch you on the next one.